Here's what to expect right after your baby is born from a labor and delivery nurse. As soon as your baby comes out, they have about 60 seconds to transition into the outside world. So this is when your care team is going to be stimulating them, rubbing their back, drying them off, and making sure that they start to cry. After these 60 seconds, your care team has two options. They can either keep baby skin to skin and do delayed cord clamping, or they can cut the umbilical cord and bring the baby to a radiant warmer that looks a little bit like this to help further assess the baby's condition. Sometimes these little stinkers just take a couple extra minutes to transition and breathe on their own, and that's why we want them in this spot where we can properly assess their breathing and give them a little bit of extra oxygen or actually breathe for them if it is needed. We may also suction their airway for any secretions that they may have inhaled while they were coming out, or if they had meconium stained fluid. This is also a reason we might want to suction their airway, and we will also check on their oxygen saturation. If baby is still needing a little bit of help with their breathing, or they're needing something called CPAP, we might admit them to the NICU for further observation, but most of the time babies are fine and they just need a little bit of help, and then they can go back to skin to skin. After about an hour of skin to skin, we will then weigh and measure the baby, put a diaper on them, and do all this fun stuff, which makes for a perfect photo op. As much as we want to know the baby's weight right away, it is really important to do that hour of skin to skin because it also helps baby to transition, and it helps with feeding, it helps with bonding, it helps with mama's bleeding, everything. So we try to do their weight and measurements after that 1 hour mark. And then we can also pick out a hat. Sometimes we can pick out a hat even before to help maintain their temperature when they are actually skin to skin. I love letting the birth partner choose the hat. It is the best part in my opinion. And then we will diaper them up and we can swaddle them at this time if mama is not wanting to do any skin to skin. This is a perfect opportunity for dad or whoever the birth partner is to get some cuddles in as well and to learn how to swaddle their newborn baby.